Hey, I know you started using Trius DX Plus in your practice. In your experience, how does it actually help provide an objective second opinion?
Exactly the way it sounds. You know those moments when you're working fast and you wish you could double check what you're seeing? Well, with TrioCX Plus, once we scan the patient, the software analyzes the images and flags areas that need attention, things that may require closer inspection.
Right. So, what kinds of conditions does it help with? Are we talking only obvious lesions or can it detect more subtle early stage issues?
You know, we all deal and treat a wide range of conditions in daily practice, but the software focuses on the most common ones, things like surface caries, tooth wear, gingival recession, and plaque. These are the core issues we see every day, and catching them early can make a huge difference.
Like tooth wear, that can seem minor at first, but it might indicate bruxism, occlusal trauma, or even gastric reflux. Left untreated, it can lead to real damage.
Exactly. And take gingival recession, for example. So common yet easy to miss in early stages. It can be caused by periodontal disease, but also aggressive brushing or thin gingival tissue around malpositioned teeth.
True, early recession is especially tricky, often just 1 or 2 millimeters. Many patients won't feel symptoms even with exposed dentin.
You know, that's where Trios DX Plus really helps us. It measures recession precisely and visualizes it clearly. Of course, we still probe and measure ourselves, but this adds another layer of consistency. The color mapping shows the degree from precursory, mild, moderate, or severe, which really helps for both me, the clinician, and the patient.
That's huge. It's one thing to say it's mild recession, but showing the patient a color coded scan can make the severity instantly clear.
Totally. You know, it becomes a communication tool, not just documentation. Whether it's recession, plaque, or wear, patients understand it better when they see it. Plaque is another great example. Patients often underestimate it, but we know how central it is to so many oral conditions. With Trios DX Plus, we can visually show plaque accumulation. Instead of just giving brushing advice, it becomes specific. You need to improve your brushing here or there, and they can see exactly what I mean.
People are way more motivated when they see the areas they're missing. That kind of visual feedback changes behavior.
You know, in our clinic, we use it to quickly and objectively visualize surface caries, tooth wear, plaque, and gingival recession. These are common, actionable findings, and the scanner supports a consistent message across the whole clinic, the whole team. So patients hear the same thing, whether they're seeing me or another colleague, a hygienist among the team. Another thing I really appreciate is comparing scans over time. It's a game changer. Instead of relying on notes or memory, I can just show patients how things have progressed or stayed stable visit to visit.
That's so helpful, especially for things like manually comparing early wear or mild recession. I can see how standardizing this would help. But is it realistic on a busy day?
You know, it's more efficient than you think. A full scan takes roughly 5 minutes, and it's perfect for those moments when you're unsure, like debating if something is worth manually comparing or treating. The software gives you a quick second look, often flagging early enamel stages, for example.
I've definitely been in that situation, wondering if a small enamel lesion is worth treating or just manually comparing. Does the software help you decide?
It supports the decision, yes, but we're still the clinicians. The software might flag something as moderate, but it's our job, to assess the full picture and decide what to do on the patient. It's not a replacement for judgment. It's just a tool that makes us more confident, especially in borderline lesion cases.
And how do patients respond when they see the DX visualizations on the scans? Does it help them feel more involved?
Absolutely. I usually say that the software flagged this area and here's what I'm seeing too. And that transparency in the consultation helps patients feel involved and not confused. It reinforces what we're working with them and not just telling them what to do.
I love that. We are not just identifying problems, we are educating and empowering patients to be part of the solution. I can see Trius DX Plus fitting easily into my routine.
Exactly. You know, it's fast, visual, and objective. And it enhances how we practice, not just for diagnosis, but for communication, education, and better collaboration.